and whatever I said before, and then complete the whole presentation about that. Basically, the goal of this presentation is to integrate the science which is behind the neuroscience and the physiology and pathology, and as well as combining with psychiatry and psychology with basically Islam, and integrating it together, and trying to explain how Islam, who completed 1400 years ago, but it validates what psychiatry and neuroscience is right now presenting it to us. So that's my goal, to make you aware of that. So that's the goal. So, and this presentation is fi sabilillah, and that's all I want. So these are the things which I like to briefly present. Pleasure. Second is happiness, reward and punishment, empathy and sympathy, theory of mind, Jean Piaget and Sigmund Freud. And we'll go one step at a time and go from there. So the pleasure, what's the definition behind in psychiatry and psychology, is specific positive reaction to certain experience. And it's along the hedonic motivation. And the hedonic motivation is desire to experience these positive reactions. So you have to have a pleasure with hedonic motivation together to enjoy the pleasure. And that's the definition of pleasure is. So in psychiatry and psychology, we know this is a very basic and very powerful drive to shape the human behavior. And how neuroscience goes through it is to find the location where it is stimulated and spread out in your brain. So we have found that nucleus accumbens, which is located like 3 or 4 centimeters behind and above each eye, is the center where the pleasure reward center gets first time stimulated. So when you have anything which is rewarding, or when you laugh, this is where the nucleus accumbens lit up. And how you will see that is from the imaging of the brain. So there are different types of imaging done. So imaging by structural imaging and functional imaging. The structural imaging, you're looking for anatomy, pathology, dysplasia, and bleeding. But in functional MRI, which we do, we are looking for the blood flow as well as oxygen and glucose metabolism. So like you have SPECT scan, PET scan, fMRI, and all those things. And the patients are pretty much awake, and they're responding to whatever you are trying to test them. And you can see in the brain that area lit up, and you exactly know where it started. So that's where the nucleus accumbens really get stimulated. That's the center, and that send the dopamine excitatory pathway to ventral tegmental area. So let me explain to you where it is located. So nucleus accumbens is over there. It gets stimulated when you have a pleasure or reward phenomena going on, and it sends the stimulation by dopamine pathway, dopamine neurotransmitter to ventral tegmental area. When it's received over here at ventral tegmental area, the job of ventral tegmental area is very excited that something really good is happening or something different is happening. So it starts sending stimulus to a lot of areas of the brain, like the limbic system, the hypothalamus, the hippocampus, and this whole limbic area, and the prefrontal cortex. These are the places where start sending the signals, and we enjoy the pleasure reward phenomena from the prefrontal cortex. This is the heart center of the brain, which we enjoy when we have reward phenomena. So let me go to the next slide. Pretty much these are the pathways where the dopamine and the reward phenomena go. So you have mesocortical pathway, nigrostriatal pathway, tubular pathway, also limbic pathway. These are all dopamine pathways. And in fact, in psychiatry, when you're doing the anti-dopamine drugs, antipsychotic medication, this is couple of these pathways are trying to block it. So dopamine basically stimulates the limbic area and the hypothalamus and hippocampus, as well as prefrontal cortex. This is where the reward and higher centers are. So, and this is another way of looking into it, the different areas of the brain. I just have that model, so I just want to present that. So let's come to psychiatry and Islam about that. So we know that pleasure sensation give you good behavior. That's a known fact. Does the pleasure give you bad behavior? Yes, that's true. It does. What are the example of bad behavior? I didn't mention, but I will briefly mention the bad behaviors which we associate with pleasure, like addictions, like gambling. These are all bad behavior from pleasure. It's the same dopamine is used here for good behavior as well as bad behavior. There's a difference how this dopamine produce good behavior here and a bad behavior in addictions or gambling. So the dopamine, when it goes over there in those centers where there's addiction, like cocaine and all those things, they are actually stimulated by 20 to 40 or 50 times much faster. And the body really enjoys the pleasure of dopamine, the excitation. So they start going into craving, like I need more because this is one thing which they have never enjoyed and they like it. So they go into the craving phase, and then after craving phase, there is what we call is tolerance. So basically, once they goes to tolerance, that means that they need more and more to get that excitement. So if they're using cocaine 3 or 4 times, that's not good enough for a day. They want 8 times, 10 times, because that is not the normal for them. So their level goes up and up because the body is enjoying so much. So now you are exciting at a very high rate, and the amount which you're giving is too less for them because the body has like, this is the best thing that ever happened. And when you go into tolerance, that is actually, when you are in tolerance, it's basically the withdrawal has started. So nothing is good enough for you. And you're sucked into that drug phenomena where nothing will make you satisfy you. So you hook up into the drug phenomena. So what's the difference between a good behavior and a bad behavior? So the difference I can say is like you are driving a bicycle in a good behavior, and here you're driving a race car. That's the difference, how much dopamine difference is going on. And that's stimulating the bad behavior. So the good behavior is slowly and gradually happens, and it's sustained for a while. So psychology and psychiatry looks into that, and they found that the positive reinforcement is the treatment, or to do it to continue your good behavior. Even for the addiction, they use positive reinforcement as a way to get them out from bad behavior and remain away from the drugs. So this is the way of approaching even good behavior as well as avoiding the bad behavior. In a positive reinforcement, what we do is a 2-step process. First, you do continuous reinforcement, means every time they do a good thing, you acknowledge them by verbally or by, by reward phenomena. So every time a kid does good thing, you reward them or acknowledge them by smile or some other way so they get acknowledgement. So that's called continuous reinforcement. Once you start doing and the kids start developing the acknowledgement and start imprinting to the mind and all those things, basically then you go into partial reinforcement, which is you do it not all the time, randomly. So 5th time, 7th time, 15 times. So they get pretty much rewarded, but randomly. By doing so, they continue the good behavior. And that has been proven for last so many years, like more than 50, 60 years, we are doing, in psychology, people are doing that. So that is the way to continue maintaining your good behavior in psychiatry and psychology. The other way of approaching is punishment. So when you punish a person, you actually produce pain. It will be emotional punishment, verbal, physical punishment. By doing that, you stop the behavior for a short term, but not for a long term period. Here also, so what the real point behind Islam is that, which I like to emphasize, that we should use the pleasure pathway to maintain the good behavior, and then keep on reinforcing by positive reinforcement. So like, for example, namaz, when we start teaching our kids, the rewards and what you get out from namaz, that you are directly in contact with Allah, and you're reciting and you are directly in front of the boss of the whole world, who's the creator of the world, and you are in direct contact with them. So start developing a reward phenomena rather than a punishment phenomena. I have seen their parents comes in and they always complain that our kids are old enough and they're not praying. And when I asked the question, and they said, we always tell them how much sin they will get. They never talk much about pleasure pathway. And I think so we should always reinforce the pleasure pathway, which is always given in Islam to enforce the pleasure pathway. Punishment is not the first or second line, but it was down the line you can come when the extreme happens, but it should be not the initial way of approaching it. So you start from early stages in the kid, and it applies to me also. I think about that myself, that if once I'm missing namaz and things like that, I look into myself, I'm missing the contact with Allah. This is between me and Allah. Nobody is here. I'm accountable for it. And if I'm in touch with Allah through my namaz, Allah is listening to me. I'm missing the huge thing, opportunity. Every day is less for me now. So I'm the one, and how much reward I will get. So from this, and how much I will feel satisfied inside. So I always approach in a reward pathway, and same thing with my kid also. I enforce more the reward pathway rather than talking about punishment pathway, because the kids are too young, and what is important to know is you try to teach them early so you have a good bonding with your kids, and then down the line they get imprinted in your mind that namaz is a good way of good behavior and establish you well. So that's why I'd like to enforce the pathway of pleasure pathway. That will be very helpful in this regard. It's teach from the psychiatry point of view that that's a very successful pathway. Now going to the next slide. Happiness. Happiness is a very broad terminology, and it's very difficult to define happiness. So nowadays psychology for a while is defining happiness as subjective well-being, and this is defined by Ed Diner. And he, which we have found in psychiatry, is that happiness is very much associated with serotonin neurotransmitter, but other neurotransmitters are also involved, but serotonin is the major neurotransmitter. So there are different type of studies are done. The biggest study which I reviewed was a grant study, which was done in Harvard Medical School since 1938, and all different type of people were involved in this, which was people who were poor to wealthy to ordinary people. In fact, John F. Kennedy was also involved in this grant study, and the Dickens study was also there. And what they have found in these studies that the strong association is from continuous charity and positive relationship, and was not money. And that was a surprising finding from that. And that was what Islam teach about. Then Martin Seligman, another psychologist, looked into all the studies and came up with the 5 different major factors leading to happiness. And he gave the acronym PERMA, which is called positive emotion, positive engagement, positive relationship, positive meaning in life, and accomplishment. Basically, Islam talk about this. Islam 1400 years talk about this, and psychiatry is validating that. That's why I'd like to emphasize on that what Islam has been talking about it is what neuroscience and psychiatry is pretty much catching up with it. So the next thing, this is the serotonin pathway. So in the midbrain, you have Raphe nucleus, which is the main serotonin it produces, and it goes to the hypothalamus, hippocampus, amygdaloid, and it spreads all over the brain. So I have another slide to explain to you much better. So for dopamine, it goes from here to the limbic area, the hypothalamus, the hippocampus over here, and then the frontal lobe. The serotonin spreads also from the frontal and the limbic system, but also spread all over the brain. So you have a pathway of both comparing and showing the overlap between both of them. These are the main centers for the dopamine and serotonin. I just want to emphasize these are the places the dopamine and serotonin goes and then spreads to the brain, just in case if you're more curious to know which are the centers in the brain it goes, and it has been labeled in the scientific journal, in the peer-reviewed journal for the last 30, 40 years. So this is pretty old stuff, but it's a very confirmed stuff. So let's come to the core concept of psychiatry. This is where I will like to, let me see if there's another slide behind that. No,
I don't see the slides. Are you sharing the slides?
Yes. Is everybody seeing the slides?
I can see them.
Yeah, we see them.
Okay.
Might
I
be
can
you
see them
use
too.
the
You may have
We
to
see
slide
them.
it on the left side.
Yusri, maybe you are picking speaker view. Go to change your view. Double click on the smaller window that you see. And then you will see the slides. Because I'm seeing the slides, everybody's seeing the slides.
Okay. So let me talk to you about the basic concept in psychiatry. Theory of mind, that's a very basic concept of psychiatry. We need to understand this before we understand psychiatry is. So the theory of mind is the ability to understand the reward and punishment, as well as motivation and intention of another person from yourself. This is the basic concept of theory of mind. It usually developed by the age of 5. So you understand what is reward and punishment for yourself as compared to your sibling and as compared to your family members, as well as motivation, intention. And that's the core concept of theory of mind is. It pretty much mature at the age of 5. This is the time when the symbolic reasoning starts. It's a very great concept, symbolic reasoning. In fact, the human being became apex predator, the top of the predator in the animal kingdom because of symbolic reasoning. The symbolic reasoning, which I gave you easy to MC square is just a clue, is the ability of a human to understand and relate mathematics with music, with arts, with science, with all the things combined together and integrate and have understanding. This is something which human can understand very well in a very precise way, to know arts and music's where it stands. And that's called symbolic reasoning. This is where in human develops at the age of 5. That's why I gave you the example of E is equal to mc square, energy is equal to mass velocity squared. We are so much capable with intelligence given to us by Allah. And that stands out, human versus angel. We have wisdom. God has given us wisdom as compared to other creation created by God, that we correlate very well and understand the concept of it and work it out. So symbolic reasoning is very important to understand. I'm going to give you all the terminology, make you understand before I go through the theories like Freudian's theory and Jean Piaget's theory, because basically these words will be used again and to make you understand. So symbolic reasoning is what association between music and maths and all those things. The other concept comes in Islam as well as in psychiatry is sympathy, empathy, and compassion. Sometimes it's mixed, but I just want to emphasize before we go further. Sympathy is just sharing the emotion of another person. Empathy is able to recognize it and then share the emotion. It's much higher because you have to recognize it and then you share it. So it's much at a higher level than sympathy is. And the compassion is empathy, plus you want to get the person out of the suffering. So it's at much higher than empathy, because Islam talks about compassion and empathy, more compassion. So know the difference between sympathy, empathy, and compassion. It's also in psychiatry, we talk a lot more about it. So I just want to lay out before we talk more in detail. The other thing which we talk in psychiatry is inductive reasoning and deductive reasoning. It's a very important concept to understand. So the core concept between deductive reasoning is you start the origin from a fact. And from a fact, you come with a conclusion that based on this fact, the other fact will be like this. Like I can give you an example. During a sunny day, it's bright during the daytime. That's a generalized fact concept. So if I go, then conclusion I can draw from there that if I go to Madrid, or I go to London, or I go to any other city, Cairo, or any other place, Karachi, then during the daytime, it will be sunny. That's a deductive reasoning. The inductive reasoning is the other way around. Inductive reasoning is you observe a fact, you drive more data and come up with a conclusion. So it's a reverse of deductive reasoning. It's used in psychiatry and research. So I just want you to be aware of it when we say inductive reasoning and deductive reasoning. So that has to be very clear that deductive reasoning starts with a fact and inductive reasoning starts with the observation, and we go around from there. This is how we do research in a university setting and all those things. I'm not going to go elaborate on this, but I just want to let you know there are different 5 layers when we go. And you can see there's an inductive reasoning and deductive reasoning. So where you start, there are 5 different layers. They go through thorough job before where you're proceeding with your research. Are this inductive reasoning you're doing research, or deductive reasoning, and what are the data you're collecting? So after going through 5 layers, we get into the data process. So it's a very thorough process when we do research in a university or very good center, that we have different layers and we spend a lot of time before we come to a conclusion. So if you hear somebody saying that since I saw this is the conclusion, so that's the final result, no, that's not the final result. In a scientific research, there's a different layers you have to go through and then come to the conclusion. So first you get the data from these process, which takes a long time, and then you analyze the data and look for validity and come up with the conclusion. It's just to giving you an idea how research is so thorough and methodical to get the research data finding out from that. Let me see what it is. So let me come to the real core of psychiatry. Jean Piaget, he's a French psychiatrist. Later on, he went to Switzerland and took that nationality. So he came up with the cognitive development. To best understand Jean Piaget, you have to understand schema, assimilation, and accommodation. These are the 3 basic concepts behind that. Schema is how you think about things. That is what schema is. And assimilation is acquiring new information on the schema. And accommodation is you add or subtract information from the schema. If you understand this, you understand what Jean Piaget was talking about. So the easiest example I can give of schema is when a child is born and he is like 1 year old and get hold of your iPhone. He thinks, wow, what a great toy I got. It is colorful, it makes sounds, I love this toy. That's schema, because he thinks about things. That's for him, it's a toy. He thinks about things, that's schema for him. Then after 2 years, when the kid is like 2 years or 3 years old, he realized, well, it makes music's coming out. I can talk, somebody can talk to me. That is acquiring new concept on his schema. Now his toy is much better. So that is where concept of assimilation is. Then when he's become 5 years old, he realized, well, it was a toy, but looks like it's a phone. I cannot play with this toy because it's my daddy's or my mommy's phone. And although it does all those things, it looks like a toy, but it's not a toy. That is accommodation. If you understand this concept, you understand Jean Piaget cognitive development, and that's what it is. So Jean Piaget talk about the schema, assimilation, accommodation concept. And then what he decided is divide the human life into different stages, which is start from sensory motor stages, which start from birth to 2 years, and then pre-operational 2 to 7 years, operational 7 to 12 years, and formal operational is 13 years onward. Takeaway point from here, from sensory motor development, which start from birth to 2 years, is the language acquisition. So you learn the maximum amount of language during that time. That's why you want to become somebody who wants to learn about Quran and Hifz the Quran at early age. We really know this is the best time to learn because you learn that language during that time, based on even from Jean Piaget theories and also. The second time which comes is between 2 and 7 years, which is pre-operational. This is a time when there's symbolic reasoning stuff. I talk about symbolic reasoning in the past, in the previous slide. So symbolic reasoning is you have tried to associate between a music and a math, and you have understanding. So this is the time when the child develops symbolic reasoning. This is the most critical time when they develop empathy, and that should never be missed. So everybody develops some sort of empathy, from 10% to 20% to 50% to 80%. But the empathy developed during between the age of 2 to 7 is very unconditional empathy. It means they love each other. There's no condition involved. They love the empathy portion. And so as a parent, we should always look at our kids, whether they have developed empathy during that time or not. Because by the age of 9 or 10, if they have not developed empathy, down the line, they will have behavior problems. And they will have difficulty in following Islam also, because empathy is a very strong behavior to understand Islam. And in fact, normal growth of a normal person to develop empathy and understand empathy. That's why I put empathy over here in red for parents to understand that your kid has developed empathy as much as possible. Now, from the age 7 to 12, these go into inductive reasoning. I discussed to you about inductive reasoning. Basically, they come with observation and come up with, then they put more data into it and comes with the, so they start with observation, comes more data, and they develop, that's the concept. Remember, they have moved upward in their thought process. They have from symbolic reasoning to they have gone to inductive reasoning. Remember, empathy at this time is much lesser developed. So I always tell to the parents, look for empathy developed in your kids much earlier than later. And down the line, when they are 13 years old, they develop deductive reasoning. Deductive reasoning is from the facts, they come up with that. So your thinking process keeps on changing as you go up. But empathy is the most important part you need to understand to develop. And to understand Islam also, you need to have developed empathy. And that is significantly important also, I feel, to have empathy and understanding of Islam. So this is the give take I have for cognitive development, that to develop empathy and you with Islam. Now coming to Freud and psychosocial development structure theory. Freud is the main person for, we love to read about psychiatry with Freud and all those things. And he developed his thesis and all those things. He developed the lifestyle, a human life into different stages, from oral phase to from birth to 1 year, the anal phases from 1 to 3 years, phallic phases 3, 4, 6 years, and latency 6 years to puberty, and genital phases puberty to death. The thing which I like to talk about this thing, id, ego, and superego. That's the structural theory. And that's very important to understand this, and then relate to Islam on that. So it developed at the time of birth or early. Ego developed a few months after birth. And the superego developed after 6 years when the oppidal complex is resolved. So it's around at the age of 6 years onwards it developed. So This is a common picture used in psychiatry and psychology to explain id, ego, and superego. So I like to use this picture for understanding. This is like water. Under the water, this is like a river or ocean. The half of the body is inside, half is outside. This is your id. And remember, id, ego, and superego is present in every human born. So whether what you are, as long as you're alive and talking, you have id, ego, and superego. Okay. So this is your id, which is under the water. Anything under the water is unconscious. That's all you have to remember. This is your ego. Half is under the water, which is half is unconscious and half is conscious. So this is your ego. And this is your superego, which is like majority is under the water. So it's unconscious. And this part you have to understand. So ego is trying to communicate with the world. This is another person in the water and they are communicating. So ego is the one who communicates with other person. And this ego is the one who communicates, and id and superego is unconscious under the water. So this, just remember this picture so you will understand properly about id and ego and superego. So what Freud said, it is unconscious, it's a reservoir of libido. What's libido? Libido is the basic energy fueling all human thought and behavior. It's totally non-rational. It's looking for immediate gratification and pleasure. That's all they were looking for. It is that. What is gratification? Sleeping, eating, comfortable. These are gratification. What's pleasure? We already know that. So it is the one that goes for it. It does not care. It needs it. Okay. Now, what Islam does, it allows it to do it, but with a cap. It has to be halal. You can enjoy gratification and pleasure as long as it is halal. So when the id gets its gratification and pleasure, it's calmed down. But the id has to be directed that there are limitations for your gratification and pleasure. You cannot do anything you want. So this is what you have to do, but you do as much as you want, but this is a limit of that. This is what Islam talks about. So I'm just giving you the concept behind it and how Islam does it, controls it. And I will explain how it does it. The second thing is superego. The superego I talked to you, it developed at the age of 6. What superego is completely unconscious, it expresses its goal as blindly as it is, but it usually develops after seeing their parents. The kid looks at their parents and wants to identify their parents. They look at the culture, they want to identify the culture, the surrounding and all those things. They try to identify and that's become their superego. So that is their superego. It developed at the age of 6 onward. And they, superego and id are always in conflict every day, as if they are always in conflict. And this ego is the one who try to calm them down, who try to rationalize, to live how you can live. How it does, the ego, according to Freud, is by defense mechanism. Look at the mature defense mechanism: humor, sublimation, suppression, and anticipation. These are called healthy defense mature mechanism. Then you have narcissistic defense, which is denial, distortion. This is not healthy. People with anxiety and depression may have, some of them have, that comes with the disease, but a normal person who does not have it, they don't go for this one, or they don't use as frequently. They usually use the healthy defense mechanism, which is called mature defense mechanism. So let me come back to the previous slide. So the fight takes, so let me bring it, the Islam concept behind it. What Islam does is strengthen the ecosystem. How it does? I give you example. By fasting. When you fast, what you do, whatever is halal during the daytime is not halal for you. You cannot eat, you cannot do drink, you cannot have any pleasure, you have to work hard and all those things. So anything which is halal during the day, sun time, sunrise to sunset, is haram. So what you're doing is making the ego train for delayed gratification in favor of future reward. So Islam makes the ego much stronger. In the meantime, it controls the id and it controls the superego. That's what Islam does. So we can go into namaz also. We can look into all the good behavior. That's where it is. Islam, with all the good behavior, enriched our ego and helps us to become a good Muslim and controls the id and superego. So we can be a very better Muslims around that time. So this is pretty much the concept of psychiatry and psychology in that. The take-home message is, I can say that Islam completed 1400 years ago and neuroscience is now, and we look back and we find so much validate the concept of Islam through modern science. And I like to bring it, that's what I try to bring it up in this lecture to explain how much it is validated together with psychiatry and Islam over here. The concept of developing a developing the strong ego, developing the empathy, and other thing is about happiness. What are the strong factor in happiness, as well as the pleasure pathway, and develop the good behavior. So that's the reason I like to bring it up, that Islam really validate what we have learned in neuroscience, and we'll go from there. Anybody has any questions, I'm free to answer it.
I do, Dr. Najib. This is Yusri. I am so happy to see you doing this. Can everyone hear me?
Yes, we can hear you, Yusri.
Okay. I'm very happy to see you doing this, and hopefully this is the start of something big. I have always dreamed of having Muslim psychologists, psychiatrists, rewrite the science of psychology from an Islamic point of view, because we have our own, like you said, Quran psychology, Quran psychiatry, and it conflicts with Western psychology in a lot of areas. As you know, being really a scientist in that field, that Western psychology was developed by mainly focusing on the illnesses or the diseased, studying sick individuals, sometimes, demented, twisted, and whatever. And that's how they came up with like Sigmund Freud comes up with the Oedipus complex and the Electra complex and so on, which contradicts basic Islamic belief. The explanation that you did on the ego and how Islam strengthens that. So Islam looks at controlling desires. The Quran and the practices and the teachings, trains the nafs to be strong, and then elevates it and keeps elevating it. And we have like several stages of nafs that we go through. So I'm really happy to see that you started this. Hopefully this will continue, inshallah.
Ameen.
Your slide, the title of your slide is Psychiatry and Molding Human Behavior with Islam. In the psychiatry that deal with a person, according to these slides, the person has to be a Muslim, or everybody, and like non-Muslim as well. And the reason for that, I would bring this example. If the person is gambling and he feels pleasure doing that,
Mm-hmm.
does he have anything inside him that he is doing something wrong?
It's a very valid question, and how you look at it. And if you put religion into the content, it changes the paradigm of it, okay? The Western world does not believe much strongly in religion. They believe, that's my concept, is that Jesus will take care of it. I can do whatever I want, okay? So we know, when we in neuroscience, when we look at the pleasure, it has nothing to do with religion. We are just looking. So they enjoy the pleasure as we enjoy the pleasure. But Muslim enjoy the pleasure when they, actually it enhances when you are in touch with Allah and with your Iman. That is a different enjoyment, and it will push you to a higher level. Means your namaz will get better. Your level of namaz and the frequency of namaz, you will be in touch, you feel that. Now the West does not understand that concept. It's very knee-jerk reaction they have. You know, you enjoy for a moment, when you're crashing, you do a start again drinking and this. So it's a knee-jerk. Muslims have a very different concept of pleasure, and they have a very constructive way. So I try to emphasize what the pathways are and how constructive the Islamic religion is to enjoy the pleasure pathway. So like Allah has given the wealth to the Muslim as well as non-Muslim, has given pleasure to all of them. But here is a difference. When you go through your way of belief, it goes differently than their way of belief. Does it helps you in my explanation?
Yeah, but in this presentation, so this presentation is limited to us as Muslims, and you as a doctor, when you have a patient, a non-Muslim patient, can you apply all what you mentioned?
Yes, I will apply this, because they will still enjoy it. You know, their pleasure sensation don't go away, correct? But I know in my heart, like in America, you have a right to die. You know, if you make a good logical decision and you know the doctor knows that by doing this you will die, but the patient says, I want to die, but I know what it will do. So you have to respect the autonomy of a patient. Same thing with here is, as a doctor, you understand the autonomy. They have a right to follow any religion and they want to do anything. So we hold our hands and say, what is best for you, do if you think. But this is my opinion, but I don't bring religion into that because this is very personal. But that's my way of looking into it.
Okay, thank you.
Any more questions, brothers?
Sorry, brother. Yeah, I just wanted to ask, not ask, maybe a comment, and just wanted to see that how, this is Dr. Kashif Anwar. Assalamu alaikum, everybody.
Oh, nice to see you, sir. Nice to hear from you.
Yeah, sure. Yeah, no, it was a great effort. Thank you for doing this. Because, you know, I'm a pediatrician, so I go through this all the time. I see all type of boy, and I was just listening to you know, the question before also how to apply things on Muslims and non-Muslims. But, you know, reading through or going through the practice and learning everything through here. So it's not that difficult for us to approach our patients who are non-Muslims. Honestly, it's more challenging for our Muslim patients. So I'm a pediatrician, so adolescents, especially when they come through, you'll be surprised what kind of challenges they go through in the schools, and they want to talk to me about it. And then I get tell me, you know, about the science as what is in general. Also, just giving an example. I mean, all of our adults. So I'm just gonna give an example, which is much more common than we expect. Same-sex attraction. I have who come and try to talk to me about it because they're scared to talk to their parents.
Cutting off. Dr. Kashif, sometimes you cut off, so we cannot hear you. If you're on the phone, come closer.
Oh, okay. Sorry. Let me just go.
The
yeah. Okay. Sorry. Let me change it to LTE probably. Can you hear me now?
Before you even start, we want you to present to us too. Okay.
Okay.
I'm sorry.
Yeah, we can hear it.
I said we want you to be one of the presenters so you can present to the group, inshallah, in the future.
We'll do inshallah.
I'm happy that he is listening to us. I think so. That's the biggest, one of the good goals he started with.
Yeah.
No, of course. Yeah, of course. When you called me, I was excited about these things because, you know, I go through these challenges every single day with my Muslim young patients, girls, boys, both. And they go through these things, which just generally all kids, because these kids are all also Americans, but they are confused more because they are Islamic values. that they've been preached upon, and then they are just as scared of sharing or discussing it with even with their parents, and they come and they're crying in front of me. I'm not a psychiatrist, by the way, right? I'm just a pediatrician, but because I'm a primary care, so they're attached to me. I've been seeing them for 7-8 years, so they've grown up in front of me, and now all of a sudden they feel comfortable talking to me rather than parents. Then I get really stuck. Then should I apply? That's what my actually comment or question is to you, that how should I approach them? Like, should I really bring Islam, which I kind of feel compelled to do because there's a Muslim child I'm seeing and their parents are trusting me to let me talk to them in private, right? But practicing here in the United States, following the science and all the books from here, it gets very difficult sometimes. Again, as one of the examples I gave you, same-sex attraction. There are a lot of Muslim kids who, because they have been growing up here, they see all these things acceptable, so they all of a sudden find themselves in those same boats, and then they try to get an opinion from me. So then I get stuck. Then what should I do? So I have to take my time and try to balance it and something like that. So what do you feel about it, Najib? Can you comment on that?
This is just don't put me on the spot, but this is just my opinion, okay?
Oh yeah. I'm just asking for your opinion.
Exactly. Yeah. So you raise a very valid question. This is in psychiatry we always see. So there's a clash in the culture. So what really happens is that when the child is growing up, when they're, which I see that when they're 2 years old, 3 years old, they are absorbing everything around their environment, okay? They cannot communicate much better, but they're absorbing. So what they see is their parents, their grandparents, and how environment, how they're reacting, and all those things. Once they start talking, they're expressing it, okay? So how the bonding took place between the parents and the child, that is significantly important. And that's why I want to raise the question of bonding. When you start to teach Quran or Islamic, you need to bond with the kid and tell them about the reward phenomenon. Teach Quran in a very healthy way and nice way structured. So they develop a good relationship and they develop a good empathy when you start from early. And once they keep on developing, they develop, imprinting in the mind, and they love their parents. Then when it goes forward, it's much easier to handle controversial things when they reach the puberty, correct? But when you don't have this thing, you have a Western culture and the Eastern culture there, and the Islamic is not being taught much, and suddenly at the age of 12, they expect you to do this thing. There's a clash of things. So it's very difficult to switch over and explain to them what to do. So means I will totally suggest to the parents first, talk to them and try to get information how much they were teaching their kids and what are their expectations, because certainly a child will not change after 12 or 15 to what they want, correct? Because you grow them up, we can nurture them to go in the right direction, but they miss a very valuable time period when they need to grow correctly.
But you're led to tell you honestly, these are some children who are from very good Islamic value families, and that's why they're scared of, because these kids growing know that this is wrong. Like one of my patients did say, he was crying and he was saying, I know this is wrong. I know this is wrong. Am I sinful? Am I'm feeling that way? So that when it comes to the feeling and comes to that, and he knows it's wrong, then it gets very tough even on parent also, because there's nothing. It's not that the parent had not taught them or they were not following the Islamic values or things like that. They've been doing everything that I could think, looking at them, talking to them and all that stuff. But, and on the contrary also, practicing in the United States, I cannot speak to the parents if the child does not want me to. If I'm speaking to a 15, 16-year-old in private, and he says, no, I'm just talking to you. Please don't talk to my dad. Otherwise, I won't talk, because then I'll be worried if I speak, then he'll keep quiet. And then you know where it heads. It heads into depressions and suicidal and all that stuff. You don't want to. You want to take this as an opportunity to talk to him, right?
Right.
But so our children also going through these things, even if we are, doing all that. So we just have to be careful. And I think that, so in other words, I had to just tell the parents, hey, you need to just keep talking, take him somewhere, talk to him. You need to dig in him. You need to talk to him. You are the best person to talk to and all that, right? But still, so these are something with a child saying, it's my internal feeling. I know it's wrong, but what can I do? How do I control it? So that's where the challenges are. And we have to, as parents, as doctors, as Muslim doctors in Muslim communities, I totally agree with Dr. Brother Gabbers. I think he made a comment about Muslims and non-Muslims, but doing this through this forum, I think if we can concentrate on how to deal with these issues as Muslim parents and Muslim children, then it will probably be something to make people aware of, that don't think that you have followed going to the masjid all the time, you're praying, doing everything. Your child will not go through these things. He may, she may. So so that's where my challenge is. So you're
Yes.
absolutely right about that's how we do. But sometimes, unfortunately, these things can happen to anyone, anywhere.
Yes, and I totally agree with you. And let's give you a simple example of drinking alcohol. This is very common. Everybody is drinking, they hide and drink. And we see that how much alcohol destroys our life. Using drugs destroys our life. We can only advocate what is good. And I think so. Sometimes we use a good therapy session with a good trusting relationship. It can change the way they think about it, because down the line there is something going on that can be identified, or it can be fixed. You're trying to fix the issue. If they realize something they're doing wrong and it's going to guilty phase, then that could be explored. At least they're opening it up and talking about, I feel guilty about it. People with depression feel guilty about it. So we go into cognitive behavior therapy and all those things. So explore where the seed lies, where the guilt lies, and what their perception is, and how they go from there. So that could be explored, but it's a very sensitive topic and very delicate topic.
Exactly.
It has to be engaged in a very thorough manner, and the therapist has to be very experienced in dealing with that, where their trust has to be maintained. And so I understand your challenge, and it's very difficult pathway.
Yeah, thank you.
I want to add something. This is very important. This is very informative. And we've been talking about this, all of us, this group, for a while. I think also our style of preaching at the masjid, and I'm talking about myself, not anyone else, has to change. We are pretty much importing a style of preaching from somewhere else in the world that does not work over here. And those of you who are old enough, that have raised kids that are old enough, like myself and Brother Mahmoud and Dr. Hussein and pretty much the elders here, we have gone through so much, and we have to change. The masjid has to change. We are talking, it's like we're in two different dimensions. We're talking over our children's head. Our preaching is designed for old people.
Totally
and
agree.
Our children are not interested, and they tune us out. So I'm glad this is open now. Jazakumullah khair. And what Dr. Kashif said now is extremely important. And like Raed said, we need Dr. Kashif to speak also. So this is what we need. We need this message to get across to the people who are doing the preaching and to the people at the masjid, so we can retool. Otherwise, we are going to lose our kids.
Yeah, that's what always it's a fear, because, and especially it gets bad when we start being strict more. Don't look at this, don't watch this. And then what happens is kids start hiding. Even the siblings start, hey, don't say it in front of mom, dad. Hey, don't say this, we'll talk later.